Hey everyone! Today I'm diving into a topic that's absolutely transforming healthcare payments, Prospective Payment Systems, or PPS for short. If you're a healthcare provider, understanding PPS is crucial to navigating the current landscape of healthcare financing, so let's break it down. First off, what is a Prospective Payment System? Simply put, PPS is a reimbursement method primarily used by government insurance programs like Medicare and Medicaid. It involves paying healthcare providers a predetermined, fixed rate for each inpatient stay or service, regardless of the actual cost incurred. This fixed amount is determined using classification systems like diagnosis-related groups, or DRGs for hospitals, and ambulatory payment classifications, or APCs for outpatient services. Now let's take a quick look at the origin of PPS. Introduced in the United States back in 1983, PPS was a revolutionary step to control rising healthcare costs. Before PPS, hospitals were reimbursed based on reported costs, which often led to longer patient stays and more intensive services than necessary. By shifting to a fixed payment system, the goal was to incentivize hospitals to provide care efficiently and cost-effectively. There are various types of prospective payment systems, each tailored to different healthcare settings. For instance, Inpatient Prospective Payment System, or IPPS, is used for hospital inpatient stays. Payments are made per discharge based on the DRG, covering all charges from admission to discharge. Outpatient Prospective Payment System, or OPPS, applies to outpatient hospital services. Payments here are made per service or procedure, using APCs that group similar services in terms of cost and type. Home Health Prospective Payment System, or HHPPS, reimburses home health agencies at a predetermined base rate, adjusted for the patient's condition and regional wage level. Skilled Nursing Facility Prospective Payment System, or SNF-PPS, involves a daily rate per patient, covering all costs for skilled nursing services. And Long-Term Care Hospital Prospective Payment System, or LTCH-PPS, uses a per-discharge system under the MS-LTC DRG, similar to DRGs but adjusted for the higher costs in long-term care hospitals. So what does this mean for healthcare providers? First and foremost, PPS helps control costs. By receiving a fixed amount, providers are motivated to eliminate unnecessary services, fostering resource-efficient care. However, there's a balance to maintain between cost control and quality of care. While PPS promotes efficiency, there's a risk of under-provision of care if not monitored properly. That's why additional programs and quality measures are integrated into PPS to ensure standards aren't compromised. Adapting to PPS also brings operational challenges. Providers need to enhance diagnostic coding and documentation accuracy to ensure appropriate reimbursement for complex cases. And let's not forget financial risks. There's always the chance that care costs exceed payments received, especially in cases involving complications or comorbidities not covered by base DRGs or APCs. Looking ahead, the future of PPS is promising with the rise of technology and data analytics. These tools allow for more refined classifications and fairer reimbursements. Plus, the shift towards value-based care models is pushing modifications in PPS to align better with outcomes rather than just services provided. In conclusion, prospective payment systems have fundamentally changed how we finance healthcare, aligning incentives with cost control and efficient care delivery. Understanding and adapting to these systems is vital for healthcare providers aiming for financial sustainability and clinical effectiveness. Thanks for tuning in. If you found this helpful, don't forget to like, comment, and subscribe for more insights into the ever-evolving world of healthcare. See you next time.